Good morning, everyone. This is Miss Patty. I'm here with Gary the Gator. Gary, would you like to say hello to everyone?
Hello.
Hello. Well, Dr. Steve has put us in charge today of answering some wonderful questions that we have from parents here at the office and parents around the nation. So, we are here today and we're going to answer those questions, aren't we, Gary?
Yes.
We are, and then we are going to give a wonderful educational tutorial today. It's going to be so much fun. Is everyone ready?
Yes,
Yay!
I'm ready.
Awesome. Here we go. Okay, so our first question of the day is from Miss Cindy in Cincinnati. Gary?
Hi, Cindy.
So Cindy would like to know, when is a good time to start cleaning baby's teeth? So Miss Cindy has a little one at home. Well, Miss Cindy, we have some great news. The sooner the better. As soon as baby's first tooth comes in, if you want to get in there with a washcloth, something that's really soft, and go ahead and start cleaning these beautiful trumpers like Mr. Gary has here, that is perfectly fine. When baby gets a little older and you want to get a soft bristled toothbrush, you can put just a smear of toothpaste on there, and that smear is going to be for anyone who is under the age of 2. Once we get a little older than 2, we're going to get into more of like that pea-size bit of toothpaste on the toothbrush head. Now, again, we want to make sure that that toothbrush has these nice, soft bristles. We don't want to get hard or medium bristles just because they're really going to hurt baby's gums. Now, gums bring up a very good point, don't they, Gary?
Yes, they do.
They do. And Gary, your gums look beautiful today. I love it. I love it. So we are going to give you some advice also. Be cleaning those gums. When you get in there with that washcloth, go ahead and scrub baby's gums and get those nice and clean. You want to remove all that plaque and all the germs and everything off of that. Okay? So our second question today is coming from Miss Elaine from North Dakota. Miss Elaine says, when should my child first see a dentist? Well, Miss Elaine, our rule of thumb is first visit by first birthday, okay? So your child should be seeing a pediatric dentist usually between the ages of 6 to 12 months. Usually we want to see a few teeth in the mouth. And by that time, they should be good to go, okay? Awesome. Okay, so our next step that we're going to be doing today, Gary, is our educational tutorial. How awesome is that? Are you excited?
That's so awesome.
I'm
so excited.
with you. So Gary has been brought in today because Gary is going to be our patient, aren't you, Gary?
Yes, I am.
And he has beautiful teeth. Doesn't he have beautiful teeth, everybody? Yes, we love it. Okay, so Gary has volunteered and we are going to show you how to properly brush these teeth, okay? So, again, we want to get that soft bristled toothbrush here, and we want to put either that smear or that pea-sized bit of toothpaste on the brush head before we go into baby's mouth. And now you can wet it. People have their preference, however you want to do. Just make sure it doesn't fall off into the sink, because that seems to happen to everyone. I know it happens to me. Does it happen to you, Gary?
Yes, it does.
I know, it drives me crazy. Okay, so the very first rule of thumb is we have a guideline that we like to follow, right, Gary?
Yes.
We call it the 2 times 2. You want to brush for 2 minutes, 2 times a day. So again, that's 2 minutes, 2 times a day. And parents, if you want better resources for a step-by-step instruction tutorial, you can check out the ADA.org. That's the American Dental Association.org. They have some wonderful instructions on how to get all of this stuff done, and that way it kind of helps keep you refreshed. A really great thing is that you can keep it posted in the bathroom on the mirror. That way it's easy for the child to read and they can see all the instructions right there. They keep things very simple and bulleted, so you'll be good to go. Okay? All right, Gary, are you ready? I'm so excited. Okay, here we go. So we're gonna again take, now Gary's a little older, so we're gonna put a pea-sized bit of toothpaste on here, okay, Gary? Now, it is important to remember, again, we're brushing for 2 minutes, but you want to hit all surfaces. So we can start on the top and then work our way to the bottom, and then we'll go side to side. So we'll start on the top, and you want to go at a 45-degree angle. Thank you, Gary. I'm going to hold your hand. So we're going to go at a 45-degree angle with this toothbrush, and we're going to go back and forth, and back and forth, and back and forth. And then we're going to go on the bottom, and again, that 45-degree angle, going back and forth, back and forth, back and forth. And that covers all of our outside. Now you want to do the same for the inside surfaces and the top surfaces of these teeth. Also, it's very important to clean your tongue. It's so important. Your tongue gets the same germs. It's inside your mouth. It's going to have all the same bit of plaque. So we're going to clean that. And Gary, can you stick your tongue out? Great job. So we're going to clean that tongue. And then we are good to go. How awesome is that? Another great way is to keep a flat surface and do some circular motions here on the side. That always helps, especially on the back molars where things build up a little more. And you also want to make sure that you can use some mouthwash in case you have a little bit of what we call halitosis here in the office, as Dr. Steve calls it. But just there's that little bit of bad breath. There are kid-friendly mouthwash products out there. They're really awesome. They turn colors where the plaque is to help them make sure that they don't miss any spots. And that really works because that's a positive reinforcement tool for them. Okay? Awesome. All right, so our last question is from Miss Amy. Hi, Miss Amy. Okay, so how often should a child see a dentist? Miss Amy, that's a really good question. So once you've hit all of these milestones that we've talked about today, you want to make sure that you're taking your child to see the dentist twice a year, once every 6 months. That way, it's a very good way to prevent any kind of overlap in dental decay and cavities and making sure everything has been done properly. Right, Gary?
Right.
Right. So sometimes the dentist can be scary for kids because it's the fear of the unknown. So we have some helpful tips. Here's what's going to happen at your dental checkup. Okay? We are going to be taking some x-rays, and we are going to be doing the cleaning like we demonstrated on Gary here. And sometimes we will be doing some instructional tutorials like we did today as well, where we can sit down with Dr. Steve. Isn't that right? And Dr. Steve can help us work on some other things. Thank you all for joining in on our video today. Stay tuned next week. We're going to talk about flossing. Yay! Say bye, Gary.
Bye.
Thanks, everyone. Bye.